Hi, Bob.
Hello again.
So, artificial joint on which side?
On my right side, 5 years ago, I had a doctor from Tampa, Florida, one of the best. He did a reverse shoulder replacement. I was a bricklayer, a lot of arm movement. I ruined that joint. There wasn't anything that he did wrong. It was a successful surgery. I was able to move my arm all over the place. I see him since then. I see him once a year, and he checks out, takes X-rays, and checks my mobility. And he noticed 2 years ago, he noticed that I had a slight bone loss around the area of the artificial joint. And then last year, when he checked it again, the bone loss had increased. So he reported to me, which was, very bad news, that I must have picked up a bacterial infection that in my bloodstream that went to this prosthesis, which they sometimes do, and it had settled in the prosthesis, and I'm losing bone loss. So this was, maybe 8 months ago that he told me this. And I'm set up for December, which this is November, late December, for a possible surgery. So what he has to do is take the prosthetic out, clean up all of the bacteria. Hopefully he can do that in a day or two, and then put a new prosthetic back in my shoulder to relieve the pain that I have right now. But what I'm seeing Lee for this morning is when I was in my car, I always have a low amount of pain, but I reached across from one seat to the other to get something off my car seat, and I felt something move in my shoulder. So I think a tendon or something that supports the bone.
You probably pulled the muscle
pulled the
or
muscle
the
there.
ligaments. Yes.
So now I have hardly any mobility at all, no strength.
Does it hurt?
Yes.
And where's the pain? Where is the pain? There.
Right here.
Okay. Okay. So definitely the muscle kind of tight and spasm, and also the ligaments, because the joint is artificial, but the muscle is still yours, right? It's not artificial muscle or ligaments. So we have two things. One is you have to keep the muscle and ligaments in balance, and so that's the first point. So you even you cannot move, you still need to keep that stretch a little bit, not to the point that create so much pain. And then that's the first one. Second, if I know people are worried about artificial joint needles will cause infection. No, because you had your knee replaced, both knee replaced, and we did acupuncture so many times. The first knee replacement and the second knee replacement afterwards, you never get infection. So needles does not cause infection, and that's one way to balance your muscle and ligaments without causing, because when you move you feel pain, so that's not the best way right now to balance the muscle and ligaments. But if we use needles, we can stretch the muscle fiber without causing pain. That's number two. Number three, you mentioned that in December you're gonna see your doctor to change the artificial joint. And I think before you do that, because that's a surgery cut open, so that create trauma. So you really have to balance your immune system so that your inflammatory process is in the right level, not too much. If you have so much chronic inflammation in your system, once they cut open, the inflammation will become even more intense, chronic, then you have long time recovering. So that's why I brought herbs. We put that together, the different herbs to try to reduce the inflammation and also improve the circulation in the whole body. So your joint pain can be reduced and your immune system is balanced. Then when you go to the surgery and change the artificial joint, you will recover much faster.
Yeah, when I talked to the doctor and he had told me that this infection, bacterial, might have started as long ago as 2 years. And he asked me if I ran a temperature. And no, I'm very much aware that I have artificial joints. If I had any temperature at all, I would have seen a doctor that had performed surgery on whatever joints I have. So
I would not agree with that point, because if you do have bacterial infection, yes, you should have swelling, redness, pain, different things.
well, the pain didn't show up right away. That's why if he noticed on the x-ray 2 years ago that there was a slight bone loss, then obviously the bacterial infection was in the artificial joint at that time. But it progresses very slowly.
I don't think
This
it's
was
infection.
2 years ago.
I think it's the inflammation, because artificial joint tend to cause inflammation. It's a foreign things. So